following portion of Daytime Tri-Cities is sponsored by SFG Medicare.
Well, having Medicare is something that most seniors count on for their health needs, and it covers most things. But on today's Medicare Tips with Andrew Price, we're going to be talking about the things that Medicare does not cover. And Andrew, good to have you back on Daytime.
Always glad to be here. And
certainly important information as seniors rely on Medicare, but there are some things that it does not cover. What are some of the big expenses?
So probably the biggest expense that it doesn't cover is it doesn't have an out-of-pocket maximum. So if you just have Medicare A and B, there is no cap on the 20% that you have to pay.
Okay, and 20%, if you're looking at a big number like $1 million, 20% would be
$200,000. So that's why people get like a supplement or an advantage plan, is to put a cap and limit that 20%.
What other high expenses are out there that it doesn't cover?
Probably a big one is long-term care. So Medicare actually doesn't cover long-term care at all. And so long-term care is when you can't take care of yourself anymore. So it's like a nurse at home or assisted living or nursing home. So Medicare actually doesn't cover that at all.
Are there supplemental plans that would cover something like that?
Not with Medicare. So Medicare doesn't cover it, so you can't get something through Medicare to do that. So people do that on their own. So what we've been doing here lately is you can actually get a life insurance plan that will, you can use your death benefit to pay for long-term care. And the big thing about it is it locks in on the price, so once you get it, it's always going to stay the same price.
Which you're not going to see if you don't have something like that.
That's right.
And then also we talk about dental and vision and things like that. Always seeing those commercials for the additional supplemental income.
So Medicare actually doesn't cover dental, vision, and hearing. So all the commercials you're seeing are actually through Advantage plans, through extra insurance. So to get those benefits, you have to get an extra plan.
And then can those plans be used obviously to cover some of those out-of-pockets when it comes to those services?
Yeah, so the Advantage plans actually include most of those, like the dental, vision, and hearing within their plan. So you have one plan that kind of covers all that kind of stuff. Medicare supplements actually don't cover dental, vision, and hearing at all either. A Medicare supplement is just going to cover that 20%.
So obviously there's a lot of information, a lot of other questions. It's not just Medicare and which plan you're going to go with.
That's right. It gets extremely complicated, and everyone has a different situation, and that's why I deal with so many different plans, is to kind of custom get something that'll fit whatever your situation is.
Because maybe you're getting ready for the long-term care, or maybe you just need extra dental vision and things like that that can come into play.
Yeah, and even husbands and wife will have different situations. So I have, a husband on a certain plan because they have certain needs, and then on the wife, might be on a different plan because they have different needs.
So the best way, contact you to go over the individual customized plans, and you're also getting out into the communities now too.
Yeah, I've been doing usually about 3 seminars a month in all of the Tri-Cities, so I have some upcoming seminars.
All right, well, we're going to give everybody that information. As always, great information. Thanks so much for joining us.
Glad to be here.
And if you would like to take part, there's a lot of dates and information for you. Those are some of the seminars that he's going to be doing. The first one coming up right at the Bristol Public Library, and that's coming up April the 4th at 6 p.m. For more information, you can always contact him as well. His number right there on your screen.
The preceding portion of Daytime Tri-Cities was sponsored by SFG Medicare.